Okay, good afternoon, everyone. Thank you for joining, and thank you to our next panelists. I've got Arnie King and Sophie Chester-Glynn from Coproduce Care, and they are going to be talking about making an impact. So I hope that you guys enjoy it. If you do have any questions for them, please use the Q&A box, and they'll do their best to answer them. And we've also got a chat box there as well. If you mark your comments or questions, you can mark them for panelists, and you can mark them for panelists and attendees so everyone can see them. Okay, I hope you enjoy it, and I'm going to pass it over to Sophie now. Thank you.
Lovely, thank you so much, Lisa. Hello everyone, good afternoon, and thank you so much for joining us. As was in the introduction, my name is Sophie Chester-Glynn, and I am the Managing Director at Coproduce Care, and I'm joined by my colleague Arnie.
Hi everyone.
And today we're going to go through something that's really close to our hearts. That's all about making an impact and how anyone can influence care law, policy and practice, which sounds like maybe we're talking nonsense, but hopefully by the end of this talk, you'll see a plethora of ways that you can get involved and you can make a difference to everything that matters in your life, especially if you're involved in health and social care. So just a quick introduction, especially explaining why this is so close to our hearts. Coproduce Care is an organisation which I set up last year. My day job is a director of a care organisation, and we supply support for people with learning disabilities, mental disabilities and for older people. And I got a little bit frustrated last year around the lack of understanding that there seemed to be of social care. A lot of talk about health. It was all about health. And I really wanted to open up the debate around what social care is, how people work in social care, and give people an opportunity to influence the policies and the laws that affect them. So as an aside, I was studying social care law at the time, and I started to have the idea of getting Coproduce Care to support people to respond to government consultations. Obviously everyone's very busy, it's very hard to know which consultation is happening when. So with my colleague Arnie, who also works in the care organisation with me, we have been getting out, finding out what consultations have been going on and responding to them and getting some really good response back. And having some of the stuff that we've done published, having our Minister for Care talk about it. And it's been really exciting considering we're just a few months old. So we thought if we can do it, I'm sure anybody can do it. And we just want people to know what the different ways of making an impact are, and hopefully just encourage others to do exactly the same, because every story, every experience in care matters, and it's making our politicians and our social care leaders understand what it's like on the ground that will help hopefully make better policy decisions. So that is the plan. Please use the chat as much as you can as we go along. If anything isn't making sense, if we're going too fast or too slow, then just give us a shout, and we will keep an eye. If you've got specific questions, then use the Q&A, just helps us to filter that a bit better. And obviously in the chat, just maybe introduce yourself, say hi, what you're up to, and keep that going. So without further ado, let's move on to the next slide. So we're just going to play something from a petition that we started earlier this year out of a frustration again that social care just wasn't getting enough recognition in the coronavirus. And we will go, if you want to hear more about what you need to make an impact with a petition, there's a certain amount of signatures that you need for Parliament to discuss it, and then a certain amount of signatures that is needed for them to have a response to the petition. But we only had 40,000. Oh, how many did we have, Arnie, at this point?
Yeah, that sounds right to me.
Yeah, about 40,000 signatures at this point, and we got a mention by the Health and Social Care Minister. So let's just play that clip.
Great, here we go.
One of the petitions that is in front of us today is entitled, "We would like the government to consider social care as equally important to the NHS." This is something that I passionately believe in, that social care is absolutely equally important. I know my colleagues in government agree, and as we heard in this debate, that is the sentiment of many honourable members, and we rightly now talk about health and social care workers in the same breath.
Okay, so it's not groundbreaking, but considering we just started that petition a couple of months before then, we were glad to at least be getting the ear of people who are, to an extent, decision makers. So don't be put off by the amount of signatures that you need. Just start something if it's close to your heart and just see where it goes. And that's going to be really the ethos around everything that we are saying today. So let's go through the agenda very quickly. So we're going to be looking at how to make an impact. We're going to look at the different options. Obviously, this isn't every single option everywhere, but it's the ones that we found have been really useful, especially over the last 6 months. So we want to share those with you, and also what you need to know in terms of scale and influence, because some engagement, some consultation responses, you know, that not all are made equal. Some make more of an impact than others. So we want to explore that and let you know what we found to be most useful. And then at the end, we're just going to have a discussion. But as I said, ask your questions as we go along. If you want us to talk more about any one of these things, then do let us know. I will sort of be talking around the concepts, and Arnie will be picking out some of the detail around it. So we're going to tag team it in that way. I think we're ready for the next slide. So Arnie, did you want to talk about around these options?
Yeah, absolutely. As you said there, Sophie, you've given a really good background, but we're not sort of political people. We've not come from sort of experts in this area or that. We're providing care at an SME level in the community, and using these ways, we've found different ways to engage in lots of ways. As you said there, the petition, which was just a small one, got something to say, exploded and got mentioned in government. There are a couple of rules around that we can always chat about, but the point is, even all the way moving up through these, as you hear about them, the point is you don't need some deep in expert knowledge of what any of them are. Once you've got an issue and you're trying to make that voice heard, there are ways to do it, and we're going to look at some really fantastic ones here, starting a bit more locally, and then moving on to that sort of engaging with government and parliament a little bit more. A little note is we don't go too much into detail for councillors and mayoral sort of level, which, to be fair, is because a lot of you will be working very closely with your councils. You'll know what those relationships are, what you can submit, what you can raise, what you can raise as an issue. But considering we're not going into it, just be aware that on that level, try and, if you haven't already, learn a little bit about your local directly elected mayor system, because that is a regional mayor system above the council, well, not above, but for multiple councils across a region, and they can sort of politically oppose the council that you specifically work with. They can be in charge of, well, everyone will be in charge of adult education, but then others will be in charge of bits of care and things. So there's always worth having a look around at those different levels as well. But really excited to talk about 3 examples.
Yeah, that's great. And as you can see, there's the councillors, there's elected mayors, there's your MPs, there's select committees, which we're going to go into in more detail, and the all-party parliamentary groups, which we've just shortened to APBGs. So when we talk about that, that's what we mean. Okay, I think we'll probably move on now to talk about engaging your MP. So this is probably the most important one, and if you are running around really busy, got a very sort of practical job, you don't have a lot of time to engage with consultations, then it's a really, if you have, not all MPs will want to listen, but that's their job. Like Arnie was saying, picking that up really is to get involved and let your MP know your situation, your issue. It might be about vaccines in your area, it might be around if you're a provider, PPE, if you're a person with lived experience, it might be something that's not working for you. It could be something around public health. Anything that you're experiencing, let them know. One of our experiences with our local MPs is that never assume that they know anything, because a lot of them are very green to what you're experiencing. Even though you see them in high places, you see them in Houses of Parliament, you see them on TV, a lot of them do not know your lived experience. So by emailing them, Google it, find out who's your local, only the local ones are interested in what you've got to say. So find out who that is for your postcode. It could be where you work, if you live in a different area to where you work. Either one will do. If you get in touch with them and let them know your local issue, or even a national issue, but very interested in local ones, then they might help you. One example that we had was a care provider who was really struggling at the beginning of the pandemic to get some PPE, and a local MP was on the phone with them till late into the evening, trying to coordinate services with them to get PPE, to get services to vulnerable adults with that care provider. And that was a real joint effort. Obviously, these are very different times, so people are working in different ways, but we are very lucky in our area to have MPs who are very interested in helping the sector. So never underestimate how much impact you might be able to have. So that's on a sort of local level. But also there's things you can do to get your question at question time in the House of Parliament. So Arnie, you know a little bit more about that than I do.
Yeah, absolutely. You've got a really important point there already. You've got an MP for where you physically live as a person, and you've got an MP for where the care setting is, that either you're accessing services or working where the issue or question is you want. So you've got two MPs there possibly that you could approach. You could approach both. Then yeah, considering later on we'll be talking about engaging with government a little bit more, we saw this as the most important one, because exactly that, with an email, a phone call, sending it over, you should be able to get your question or your concern put to government and get a response. The rules around them are changing, to be fair, to deal with COVID and sort of physical processes of how politics happens in Parliament are affected by that, of course. But still, there's an obligation to answer written questions. So at the end of the day, even if you're sort of the most disenfranchised that you could possibly be, the fact is, if you send the right messages to your MP saying, I want this answered, they can push that forward. If they're a really fantastic MP, they might start talking about all the other debates that are going on, all the other things that are going around politics. And yeah, there's a little point there of saying they could even raise a bill. It's called Private Members Bill. So that's asking for a law to be made. It does happen. It's a very, very sort of we're raising awareness thing. We're not really sort of expecting a law to happen if you go that route. But the point is, that is your point of contact for Parliament and government. Just get a hold, send your question, and they can make sure the government answers.
I wonder, Arnie, with that, if you put in your email to your MP, I would like to have, this is a written question for you. If you put that terminology, do you think that they would feel more obliged to take that forward? Because as I understand it, MPs have a certain quota of written questions they can put basically in a box when they go to Parliament, and then they'll get chosen which ones will be allowed to be asked during the Commons question time. So do you think that people should do that?
Generally, that's a great point, because sort of on a objective level, that's what your MP's for, to represent you, go to government and say, this is an issue, this is a question we wanted answered. There's a couple details though. If your MP is sort of in the government political party or the opposition party, if they're at sort of cabinet level, opposition cabinet level or not, that affects how many questions and what questions they're going to be willing to sort of publicly go out and ask. But as a route one, if you're saying, I want to find this out, or I want this raised in government, it's that way. That written question does always require a response.
I know it's not time for us to answer the questions, but someone has asked, what if your local MP doesn't engage with you? Would someone who isn't local help? What's your first thoughts on that?
Yeah, I've got two thoughts there. One is that's where it becomes important that you physically live somewhere and the care that you're talking about happens in a setting somewhere. If that's in 2 different places, you've got 2 MPs to try. On another level, if your MP isn't engaging you and you think that is just bad MPing, then absolutely, you've got councillors, you've got any other MP, any other politician that's in that area. And as we probably move on to the more proactively engaging with government, APBGs and select committees, there's ways that you can even sort of involve that at an escalated level.
Yeah, great. Okay, let's move on then, because someone's mentioned select committees as well, so we probably need to whiz on to that. So really quickly then, this slide is sort of all about planting the seed, doing something. I feel sometimes people feel very disempowered with, well, what can I even start with? Something's really really annoying me, and I just want to get something done. And I'll just describe my journey. When I set up these calls that coordinated the different parts of our sector locally, when lockdown happened in March, just before lockdown, we had our last meeting, and I felt really anxious. I was worried that providers in the area may not be talking to each other. We might be able to help each other with PPE, staffing, all sorts of thoughts. And I was like, well, how are we going to communicate? Local authority were obviously busy sorting themselves out, thinking about what they wanted to do. So then I just went ahead and started a weekly call on Zoom. And I said, anyone within our CCG area can come along, and we'll have speakers, and we'll just see how we coordinate responses together, how we work together, we share knowledge, worries, concerns, documents, policies. So that's what we did. And we tried to organise it as much as we could. I got in touch with the local care association, and they agreed to co-chair these meetings with us. And around about March, we had about 130 people on one call, but it wasn't just the amount of providers we had. It was someone highlighted to me, and I didn't really think about it at the time, but it was the amount of different professionals we had in one room, as it were, in one Zoom call. So typically we'd have an MP, we'd have a local authority from the different local authorities in our area, we'd have someone from the CCG, somebody from someone else from health, and everyone would give a 10-minute update about where they were or where we were as an area on the crisis. And then providers were able to ask questions. Some people had issues with payments, and what came up on the chat tended to be what was responded to quite quickly afterwards, because local authorities almost had like this platform where everyone was seeing all the issues in the area, so they felt this urgency to kind of address them, rather than when people were just emailing in and seeing their emails ignored. So that was a really good way of getting people to react quite quickly. We also set up a WhatsApp group, so when providers were running right at the beginning, before we've got the help that we have now, and we were trying to get PPE from everywhere, anywhere, we just communicate with each other and say, well, this supplier has run out of PPE, why don't you try this one, has got sort of this amount of stock left. And we just chatted really quickly and responded over WhatsApp. We've continued doing that and sharing risk assessments. But also there's loads of other things people might be familiar with, like Facebook groups, open ones, closed ones. There's some great ones out there. Skills for Care runs one. I think it's Jonathan Cunningham. Oh, I just made that name up, Arnie. I think he's got one as well. So that's all helpful. I know everyone seems to be doing more now, so you're familiar with that. But at the beginning, that helped. But anything that you feel that's within your reach to get out and do something, yeah, that's the one.
If I can just jump in quickly before we move on, let's not forget that these things started for us before the pandemic. And again, without us being sort of political experts, training specialists or consultants or anything like that, being a provider in the community, alongside having to build up sort of technical capacity, which I think a lot is going to be a big issue with care, especially how sort of unevenly people are able to deal with that, we just realized that we could just start connecting people and just create those conversations around technical law, changes to guidance, considering these things are such a huge part of people's lives and their employment, and seeing that level of confidence, one, be so low to start with, but then second, just grab onto a space to talk about it and have that voice wherever it is. It was what, a couple Zoom calls in a few afternoons to respond to consultations at first, and it's just grown. So it is not like you have to build everything to have any of this kind of networking or conversation happen.
Good. Should we move on to the next one?
Great.
So select committees, you can obviously engage in any way you need to with them, but the Health and Social Care Select Committee is one that regularly you're able to, they'll try doing quite a few inquiries. So if you engage with them and see what they're doing, then it's a very good idea to see what they're doing and respond to them. And one of the things that we have done is we've responded to the Health and Social Care Select Committee inquiry on the workforce. So they brought out an inquiry earlier this year, and they wanted to find out how, originally it was billed as being, how does the social care help the NHS, which if you start off with social care, if with the NHS, and you say to me that social care comes second, I kind of get triggered. So I'm glad that they did change that to say, well, how can we integrate the two, and how can we support each other? So we did that, and I mean, it was more work, so you might not be interested in doing so much work, but just our journey, we did go out and we did ask, we had a questionnaire to the sector. We got about 400 responses in a couple of weeks. Then we did a report and we submitted that report, and we'll wait yet to see what comes out of that, because the great thing with select committees is when they do reports, unlike APPGs, the government has to respond to that report. So if you are going to think about what do I engage with, that is going to give you the most feedback if that select committee then goes on to write a report. And they have written reports recently. Some have come out the last couple of weeks, not on this one as far as I'm aware, but there still is hope, and I'm sure that will come out. Arnie, have I missed anything?
No, that's a really great description of what going through them is like, and their responsibilities. Maybe just for a bit of detail, we're moving away from our first two examples being what you can just do, what you can sort of get sent off into government. And now this is engaging with Parliament or government. This is a formal process where an issue is being looked at, and they have to sort of very visibly show what the process is of collecting evidence, speaking to experts, and then making serious recommendations for change. So you can send in any relevant evidence. If you get other people around you sending it, helping you send in a joint response, it will be bigger, and it will never not be accepted, even if it's sort of tokenistically then just said, oh, we've got this as well. It will still be looked at, and you might even be sort of involved in further, and you'll have a much better idea of what are the usual suspects of who gets reached out to, which is not a problem with us at all. We're not slating anyone or big groups or consultancies or anything like that, but obviously taking away the engagement we already have isn't going to help anybody. But if you're only speaking to the same people in the same way, of course the same issues are going to keep occurring.
One thing I might want to do is explain this slide, and just say that the Health and Social Care Committee, this is who they are at the moment, who they're made up of. It's a, what's the term? Like all the types of politicians from all the parties are in the select committee.
Non-partisan?
Yeah, there we go. And the little clip there you can see is of a care manager. So if you submit evidence, then they may call on you to, so written evidence, they may call on you to give oral evidence. So they'll interview you and it will be streamed live. And that's a care manager who was asked to come and give evidence. And she talked about her journey. She talked about the issues that she's faced. And it's those stories which you might think are just not particularly interesting or everyday life for you. That's actually what they're really interested in, because they haven't got a clue, haven't done a shift of care in their lives. So those kind of stories are really important. And the way that she got on there, you can get on there as an individual, I think, but it was through Skills for Care, who then went out to their network and said, would anyone like to be involved in this? So definitely, if you yourself don't feel confident to give in evidence, then see, most people are in touch with Skills for Care. If you're a registered manager, you might be part of a network there, and just make it known that you have some really strong views and you really want to express them if there's an opportunity to. And there usually is a lot of opportunities right now, more than there's ever been. So that's a really good way of getting engagement right at the top. And you can see some very familiar faces on that committee there on the slide. Should we move on? So this is now the APPGs. Can you go through this one a little bit of detail, Arnie?
Absolutely. So yeah, considering, as I've explained on the last slide, we've moved to that sort of higher end, properly engaging with government or parliament. The select committee is a very formalised, official, structured thing. APBGs are sort of like a working group. So any group of politicians can decide that they are interested in a topic and are going to look into it. They don't have to involve experts in different things. They'll conduct similar reviews, inquiries, the same process of just gathering as much evidence from on the ground or consultations or again experts, and then creating those final recommendations and reports about the issue. There's about 700, I think, would exist now, and that's split between one for every country of the world and groups of country, like sort of Commonwealth groups and things, and then subject choices, and that can be absolutely anything. You can just see a handful of them on the screen now. On our experience level, again, that means you are engaging with politics, maybe closer to how everyone sees politics when you talk about politicians, and nothing has changed and everything going off and happening, because there's no sort of structure to these in the same way as select committees. All they have to do is register their details every 6 weeks, so you can see who's on it and what spending's been done. So yeah, great example is on our slide there. The elevation, registration and standardisation was a whole inquiry that ran last year that we submitted again evidence to in the same way we would a select committee, and then they've created a really good report. It's a really honest sort of reflection of the arguments around making care more structured, more professionalised, more regimented, and more sort of sustainable as a sector, without over formalising it and putting off the people that it would, who we depend on. But then also there might be other ones that you don't really hear that much about, and there's a very large lobbying group that is doing lots of secretariat support. There's one particularly in mind I'm going to keep an eye on, but we don't actually know what's happening there. So still really great to engage with, is the best level of, hey, I've got an issue, I know what's happening to people around me, and we know what would fix it. I'm taking it to politics. What are you guys going to do about it? Here's fantastic chance to do that, but then you are stepping into politics for real.
Yeah, I mean, this is like you say, it's a great way to get involved. There is, like the select committees, a duty for the government to respond to any reports that are put out by the APPG. So in terms of what kind of impact you want to have, it's not as strong as that. But I mean, when we, like Arnie was explaining earlier, when we submitted our evidence around what we thought about the registration of social care workers, obviously that's a hot topic at the moment, we found that a lot of what we said was represented in the APPG's report, and that was the APPG for social care. So they've got they've done a report, it's been published, it's out there. So you could, I don't know, however you want to use it, but you're still influencing politicians in some way and getting your voice out there. But as we say, there isn't so much of a pull for government to respond to those. So we probably could move on at this point. And I suppose it's just some closing thoughts really before we go on to your Q&As. If you've got any, please do pop them in, or if you want us to go through anything else in more detail, let us know. Yeah, your issue always matters, no matter how small it is. It's just make sure you make somebody aware about it. Who, how, and what is affecting you, think about it and just think who might need to know about that. Even if you feel that a lot of your own colleagues within social care, it's a well talked about topic and you're all on the same page. You will be so surprised how little MPs are in tune with what's going on in our world in social care. And of course, you know, your voice is really important. Those real tangible stories that they just wouldn't know in any other situation. And of course, the solutions are never going to come from the top unless they know what's going on in the sector and people who are working in it. So really, you know what you want to change and think about what might be the best way for you to do that. And we'd love to hear in the chat or in the comments if you think you're going to go away and think about any of the ways that we've talked about today, and then go and engage with any of them. But yes, do we have any questions, or have I missed anything, Arnie? Maybe you can add anything.
Should we shoot over to Q&A? I think we've got 10 minutes to try and start seeing, only because I have to stop sharing. I can't see the chat right now.
Yeah, okay, go on, let's do that. So we've got one question. What is the best way to approach policy changes in times where it may not feel appropriate? For example, addressing issues within the care sector during COVID, when care workers are working under extreme stress and pressure. What are your first thoughts on that, Arnie?
I think it's a really, really important question, because one, it can feel like now is the time that you're least likely to be heard. Everyone's calling for things, and it's a sort of very confusing time for everybody. But also look at the huge sort of changes we've already seen that would have been impossible years ago. Sort of tranches of money, for a word that everyone liked for a few weeks there, and different ways of engaging. And we've got considering the way you can make an impact very quickly is by proving that this affects people, and it is something that affects constituents and people out in the public. We are an incredibly important sector right now, both in terms of the people that will need services and the structures that exist to provide those services across the country. So I think, understandably, could very easily understand that, well, I've always wanted to do this, but now's not the time. But on the flip side, I think now is the most important time, and you'll just see, engaging with your MPs, engaging with these products, engaging with people around you, you'll quickly see who else has got it, but now is a real opportunity to get something that's been the same issues for lots and lots of years.
Yeah. So do you believe the grassroots political activity in the sector is, it's moved around, is vital going forward in influencing policy? Grassroots, what do you think? What's meant by that, Arnie?
There's a couple things there. I think it's a really interesting question to actually consider unionisation, considering we are we are not politically aligned to anything. We're not political people. We're not from anything political. We're not advocating for something political. Unionisation for social care is a really, really interesting idea, because the sort of general first steps of unionisation is working collecting things. I can put a lot of pressure on providers, where of course there are bad providers out there, but the system also puts a lot of pressure on providers, which means sort of people of care worker level coming and saying, oh, my provider needs to pay me this and this and this, for example, might not be a change that can sort of be very good. But you've got a nice mix of things already happening, where, because it's closer to sort of advocating charities. There's some really great people that, especially as we move into informal care, people caring at home part of the time, that are just making that argument. They're working with people, they're getting really, really good evidence of here's the issues and here's ways to change it. And you're seeing it there, you're seeing it publicized. And exactly, even if you're the most disenfranchised person in the world that thinks nothing in politics is ever going to change, if us all together are doing it and finding these solutions and talking and just being aware of each other, it's certainly not as sort of mountain.
Yeah, I agree.
Time.
I'm a big supporter of that. I think that's one of the things that we don't do much, because in the care sector we don't like to go out, we don't strike like health service like anywhere else, but I think being part of a union does give a bit of power to people, to individuals who on their own would feel really wouldn't feel as powerful going and speaking to people about issues and getting their rights obeyed, or if you like. Yeah, just looking at the next one, template to send to all MPs. Yeah, there's absolutely nothing wrong with that in your area, nothing wrong with that at all. Building relationships with MPs would help push your views forward, absolutely. So people that we've got relationships with now, they engage with us quite a lot. They might even come to you and ask for more information. So one of our local MPs said, I really want to understand what's the lived experience of people of colour who also work in care, and some other issues. So our local care association picked that up on one of our calls and did a questionnaire and is feeding that back to the MP. So you'll have some MPs who are just so engaged and they want to know more from you. So the more that you tell them, the more they actually might come back to you for more information. And building those relationships is just to start off getting in touch. And if you've got something going on, maybe invite them to a team meeting, or invite them to something that's going on within your organisation and see if they want to take part, and then slowly build up those relationships. Every MP is going to be different. We've been very lucky, and I've also been in touch with MPs where it's like tumbleweed. It's almost like they want to avoid you like the plague. So it's not easy everywhere. I totally understand that, but definitely give it a go.
Got a couple of good questions here, but maybe you might want to...
Is that on the chat? Yeah.
The last slides. Oh, these came from before the chat, actually, but...
Okay, there's some in the chat. I haven't been keeping up with the chat. Let's have a look.
If you can find a 1, 2, 3 MPs that engage when seek engagement with some members of House of Lords too, can be easier. Yeah, there are a few rules and differences in the select committees and APBGs at House of Commons and Lords level. For select committees, it's the subjects that they're on. At Lords level, there is economics that I think they cover, which maybe on the workforce or funding side, that might come into it. But then the subject choices for select committees tend to be in the House of Commons. But that being aware of Lords is really, really interesting. But with APPGs, it's especially interesting. So if you are maybe a little bit more willing to be nerdy like me, you can sit and spend time reading the register of APPGs and see who's on them, who they're involved with, what other things they've done, and the Lords become very important there.
Absolutely. And someone's asking about funding. How do we get to find out? Our voices heard around getting more funding. Again, absolutely any of the ways that we've mentioned, in fact, if that's just a subject as far as I'm concerned, and that could cover any of those. Obviously at some one point an inquiry might be delving into funding specifically, but any of those ways at all, just raising that issue. Arnie, were you going to come back on something?
There is one point, specifically with petitions, there's 2 rules that you should know, other than the full list of what counts as liable or anything like that. But 2 rules are, 1, it has to be on the government portal, so you can't go off and do it yourself and then bring the whole petition over. But 2 is that the government won't respond to petitions that are about things that the government aren't in charge for. So if the funding issue is closer to your council, be aware that there might be a bit of resistance from a government saying, this is local authority politics, go to them. In that case, go to your council, work with them. If they're saying it's the government, say, what can we do then? What can we do together? How are you going to back me up telling the government that this isn't working and I want something else?
I think we have pretty much come to time, haven't we? And there's no other questions. And someone asked if we share our slides, and that's absolutely fine. We will do that. I think they mean sort of afterwards.
I was getting our sign-off slide, sorry.
Ah, right, sorry.
But it's not working.
Yeah, but I think that was, so hopefully everyone found that useful. Of course, if we are engaging with consultations, we are trying to feed back to local, national government all the time. So if there's an issue or anything that you want to bring to our attention, maybe we do a joint response to something, then do get in touch. You've got our contacts there, hi@coproducecare.com. We're on Twitter a lot. So we have a YouTube channel where we talk about these issues. We've got a string of live streams about Black History Month and social care. So we're very active, and we just love to get people together and to get voices heard. So do keep in touch, and we hope that was useful. Thank you.
Thank you, Sophie.
Hi.
Thank you. That was brilliant. We really enjoyed all of that. It was really informative, and I hope everyone watching enjoyed it as well. Stay tuned, everyone, because coming up next, we've got Dr. Canoria, who's going to be talking about fixing the funding crisis in the care sector. So that one should be interesting as well. So thank you for joining, and thank you, Sophie and Arnie. It was brilliant.
Pleasure.